What started as a welfare check ended with physical and emotional scars. That's what a lawsuit filed today against Austin police claims.
KXAN's Yoojin show spoke with the man who says APD really needs to take a closer look at how it handles mental health calls.
And I feel very fortunate that I wasn't killed like the person they shot at the condo a couple of weeks ago.
It's been almost 2 years, but Jim Templeton says he still remembers.
White, hot, searing pain.
This picture shows officers approaching Templeton with their guns drawn. This video shows him in handcuffs.
I had done nothing wrong. They were sent to do a mental welfare check.
Templeton says when he was put into the cuffs, the officers twisted his arm so hard.
They ripped my rotator cuff, my bicep tendon, and my labral tendon.
Templeton says the way APD handles mental health calls must change. APD's policy says if officers believe the person they're responding to, his or her mental health is affecting their behavior, they should call for a specially trained mental health officer. In Templeton's case, he says it took a crisis intervention officer 2 hours to get to his house. While waiting, Templeton says he received no medical attention, and despite telling the officers he's not going to harm himself, they still used the peace officer emergency detention and took him to a treatment facility. He's undergone shoulder surgeries and physical therapy, but says he still has nightmares about the interaction.
I don't wish this to ever happen to anybody, whether or not they're having a mental health crisis. This shouldn't happen.
Yoojin, KXAN News.
The city of Austin learned about the lawsuit during last night's city council's budget hearings. APD said it's familiar with the incident and the city is prepared to defend the actions of the officers. We checked in with the Office of Police Oversight to see if anyone has filed similar complaints there. The office received a total of 719 complaints about officer conduct so far this year, but it doesn't track data specifically on calls related to mental health. An Austin Assistant Police Chief tells us they use a peace officer emergency detention on average about 14 times a day. That's when the officer believes the person is mentally ill and poses a threat to either themselves or another person, and there just isn't enough time to get a warrant before taking the person into custody. If there's a bed, that person goes to a treatment center, but if not, they're taken to a hospital emergency room.
APD's policy is that officers should try to avoid arresting someone struggling with mental health issues. Here's what their guidance is instead. Aside from requesting a crisis intervention team member, officers can ask for help from a local mental health authority. The go-to is Integral Care. Their response group is called the Expanded Mobile Crisis Outreach Team, or MCOT. MCOT can respond within 30 minutes of calls placed during these hours that you see on your screen. You can see that they're slightly less available to officers on weekends. As for when officers should arrest someone that they suspect has a mental illness, if a felony crime has been committed, if the offense involves a gun, or if the person meets the criteria for a peace officer emergency detention.